Hello everyone, my name is Aarti. I'm going to talk about a data linkage study where we have linked the Australian Orthopaedic Association National Joint Replacement Registry data with the pharmaceutical benefit scheme data set, and we have analyzed the antibiotic utilization among the joint replacement patients. I'll start with acknowledgement. This work is supported by the Australian National Health and Medical Research Grant, and we also acknowledge the services provided by the Australian Institute of Health and Data Welfare. In my talk, I'll give you a background of this study and then what are our aims and what is the study cohort, the methods we have used, the result, and finally the conclusions. Now to start, we'll give you a background. So this joint replacement registry, they collect the information on all joints like hips, knees, shoulders, spines, and other. And they also collect the information about the patient demographics, the procedures, the surgeons, information about the hospitals, mortality, and as well as the revisions. And prosthetic joint infection after the joint replacement surgery is a serious complication and which causes the 18% of these reoperations or the revisions and leads to increased morbidity and mortality. The use of perioperative antibiotic is one of the key factors to reduce this infection, but however, very little information is available about the baseline use of these antibiotics before and after the surgery. So this is our aim. So our aim is to describe the community use of this antibiotic dispensation before and after the primary hip procedure, and what are the changes in this use before and after the revision procedure. For this study, so we have a data cohort group. So all persons undergoing total hip replacement procedure for osteoarthritis in Australia during 2002 and 2017, and the linked data is in the pharmaceutical benefit scheme data set for the same time period, which records the medicine dispensing information for all Australians. And how we define the antibiotics. So antibiotic dispensing was determined using the WHO ATC classification code, starting with JO1, JO2, and JO4. And we group these antibiotics as orals and injectables. On the left-hand side, you'll see there's a data flow diagram, and you see that we have used a quite large exclusion criteria. So this was done to reduce the likelihood of overestimating the dispensing rates because we are using this PBS administrative data sets, which has some limitations. So after following this exclusion criteria, we ended up reaching the three main groups. The first group is the primary hip procedure with no subsequent revisions. And you will see there is like more than 96% of patients lies in this group. And then the second group is where the patient has a revision, but for non-infection reasons. And then the third group is the patient who has revisions for infections. And you can see that the median age among all of these groups are pretty same. It's around 71, 72 years old. So it's an older cohort. And what are the methods we used? So antibiotic dispensing are defined as the first dispensing of any antibiotic medication before and after the surgery for a given time interval. And these time intervals, these are the monthly interval with a period of 30.4 days from the day of primary or revision procedure to the date of dispensing. And we calculated these intervals for up to 2-year period. And third, then is the prevalence rates, or the antibiotic dispensing rates. So these are the number of patients with at least one antibiotic dispensed in each month, divided by the total number of patients at risk in that month. And the patient at risk was censored for death and end of follow-up. These rates were expressed as per 100 patients per month, and we also calculated the prevalence rate ratios and their confidence intervals using the Poisson model. And here are the results. You can see that. So we have the antibiotic dispensing rates, and here is the before they have the primary procedure, and here after they have the primary procedure. And basically this line represents when these patients has their hip procedure. And there are three groups. The blue group is a primary no revision, green group is a primary revision for non-infection, and the red group is a revision for the infection reasons. And their monthly dispensing, these are the monthly dispensing rates, which are pretty much similar before they have their primary hip surgery. So like 9 to 10% patients have at least one antibiotic dispensed to them. But these rates are very much different once they have their primary procedure. the primary no revision and revision for non-infection group, they pretty much stable down after the first month to their pre-primary rates, but in the revision for infection group, these rates are much higher. And if we look at their overall rate ratios, it's pretty clear that the revision for infection group has 69% more antibiotic dispense compared to the non-revision group. And then these are the results for the revision group. So who has revision? So these are all the antibiotics dispensing prior to the revision, and these are all the antibiotics dispensing after the revision. And you can see there is a clear difference between the infection and non-infection group. So the before revision surgery, the antibiotic dispensing rates are 2 times higher in the revision for infection group compared to the non-infection group. So here are the rate ratios for these 2 groups. But following the surgery, you can see that the infection group, their use remains quite high and elevated up to the 6 months. But even after the 6 months, they didn't go down to as close to the revision for non-infection groups. So this remains still high, which may be indicating these patients are having another episodes of infection, which is not good. And then we have looked at the different types of antibiotics. So injectables and orals. So injectables are most commonly dispensed in the first to second month before and after their surgery. And you've seen, and this red one is the vancomycin, which is the most frequently used among these patients, followed by the flucloxacillin and the cefazolin. You can see here there is a very little change in the non-infection group about the injectable antibiotics. So they have used pretty much for 1 month, and from second month onwards, it's like very minimal use. But here in this infection group, you will see there is a variety of the injectables used, and it's used for quite a long time. And then what about then there is the next are the oral antibiotics. Oral antibiotics are used as the majority of antibiotic dispensing, like saying 86% of the antibiotics are orals that's been used, and the most frequently used, and they are used after the first month following the surgery. And in the non-infection group, here you see the pink one. This is the cephalexin, which is predominantly used before and after the surgery. But here in the infection group, you will see there is a bunch of different oral antibiotics that's been used here. And you find the ciprofloxacin, fusidiate, and rifampicin were more commonly dispensed. So it's a bit different pattern to the non-infection group among these patients. And then finally, the conclusion. So using this linkage, we were able to determine the baseline antibiotic use rate of these hip replacement patients. And we found that there is like 9 to 10% use were found. Antibiotic dispensings following the surgery for primary no revision and revision for infection group remained similar, but not for the revision for infection group. Their dispensing rates remained elevated and sustained throughout the period. So this high prevalence of antibiotic dispensation, this raises the concern of overprescribing as well. And the different patterns of these antibiotic dispensing before the revision surgery may alert clinicians that there is a possibility of undiagnosed infection, and this leads to further investigation. So what are the next steps with this study? Using the MBS, the medical benefit scheme data set, and this PBS data set, we will able to develop an algorithm to find patients with infections who haven't had any revision surgeries yet. And thank you for listening.